Now, I'm going to make a lot of people angry, and I really don't care because the most important thing is when I'm treating your blood pressure, I want you to know that you can treat your blood pressure without medications for some people. But it's important that we talk about this because unfortunately, not enough medical personnel are talking about it. Not enough doctors, nurses are talking about, yes, there are medications that we can use to treat blood pressure, but we also want to do our best to get them off these medications. And that's why I created this acronym, EWS/NS and another F. Now, if you're doing all of these 4 or 5 things, you should be able to come off of some of these medications. You should be able to come off, if you can, all of your medications. But once again, I don't think it's being talked about enough. And in this video, I'm going to talk about the 5 ways that we can treat our blood pressure naturally, aka without medications. My name is Dr. Isang, and I use this platform to discuss heart health and prevention. But today we're going to be talking about hypertension and high blood pressure. One of the reasons why is because it is known as the silent killer for a reason. So if you don't get this treated appropriately, you can end up having a heart attack, and that's not what we want. So what is considered high blood pressure? When you think about the numbers that we're shooting for, or numbers that we want your blood pressure to be, it's 120/80, if not a little bit lower than that. We don't want it to be in the 80s systolic, but definitely not in the 130s, 140s, 150s, because the higher your blood pressure is, the harder your heart is going to work, and over time can lead to the heart enlarging, which can lead to heart failure, can lead to strokes, heart attacks, etc., kidney disease, needing to be on dialysis, and potentially needing to be on transplant. More importantly, or just as important, is that all of this is expensive. It costs a lot of money to treat hypertension in the end stages with the complications. So a lot of times when people are, coming to see their primary medical provider, they're, for high blood pressure, you're going to be put on medications. Now, there are some individuals that, boom, from the start, you probably need to be on medications, especially if you've been in the 160s, 170s for a long period of time. It's going to be really hard to bring it down to the 120s in a short period of time without medications. But in addition to medication, but if your blood pressure, especially if it's in the 120s to low 140s or 130s, I want you to try to get you off of these medications as best as possible. Now, going back to the board, the first step is going to be exercise. Now, you hear a lot of physicians talk about this, doctors, nurses, nurse practitioners, physician assistant, exercise. But the bigger question, the bigger question is, how much should we exercise? Well, the American Heart Association recommends 150 minutes of moderate activity each and every day. Things like walking on a treadmill, on an incline, a light jog, bicycle. But with that, you also can consider doing high intensity interval exercises. With this, it is 75 minutes per week. So anywhere, however you want to split it. I like to think in the 30 to 50 minute exercise routines, whether you're doing 30 minutes 3 to 5 times a week, ideally 5 times a week, or 50 minutes 3 times a week. What I care about more is consistency. So if you can allocate anywhere from 15 to 20 minutes a day, but do that. But also, once we've finished talking about all of these, incorporate these other things, you're gonna see your blood pressure improve over time. I can almost guarantee you that. I'm gonna put this. This is the one reason that it may be difficult to treat it without medications for certain individuals, and that was what was true for me too, because I've been on medications since my early 20s, and even when I was lean meat, delicious piece of steak that I was, still on blood pressure medications, at least just one. But 150 minutes of moderate intensity exercise is what we recommend, doing that consistently, but also working on these other things. With exercise, the second step is going to be, starts with a W. If you can guess it right, it is your weight. Weight plays a huge factor when it comes to our blood pressure and our blood pressure not being as controlled as we want it to be. You can imagine that, in fact, that the recommendations are that if you can lose, for every 1 kilogram or 2.2 pounds of weight you lose, your blood pressure will reduce by 1 millimeter of mercury. So what does that mean? If you lose around 22 pounds, the top number is going to reduce by 10. So with exercise comes with the weight loss, but the weight loss only comes with appropriate nutrition. Speaking of nutrition, number 3, I put an S/N, and that's for salt and nutrition. So, American Heart Association, the typical recommendation for salt is around 2,300 milligrams of salt per day. If you do have high blood pressure, we definitely want to reduce it significantly. People start to see significant reduction in their blood pressure without being on medications when they're reducing it to less than 2,000 grams. Some people even try to restrict it to around 1,500 milligrams of salt to really push that blood pressure down. Now, if you can imagine, what is 2,300 milligrams of salt? That's about a teaspoon of salt right there, and that's what you're allocating for a full day. So imagine bringing that down to 2,000 and 1,500. It's going to be difficult. It's going to take some time. It's going to take getting your taste buds used to not tasting as much salt. But with doing that, with the exercise, with the weight loss, you're going to see your blood pressure start to reduce. In addition to that, nutrition, to the point where our biggest recommendation is the Mediterranean diet, or to incorporate reducing your blood pressure, the DASH diet, dietary approach to stop hypertension. This looks at reducing the amount of processed foods is going to be the biggest thing because they're packed in salt, reducing the amount of red meat, increasing the amount of fruits, vegetables, lean proteins. I always want to say reduce and not stop, because if you completely eliminate it, that sometimes deters people from even wanting to. A lot of my patients, however amount they're eating, I tell them to cut it in half. If they were eating at fast food restaurants, 3 times a week, cut it down to 1 to 2 times a week, and watch yourself start to improve, because when you feel your body start to feel better, you're going to start to make those appropriate changes to continue feeling well, continue to lose weight, decrease your blood pressure, and prevent significant issues from happening in the future. So salt, reducing it down to at least 2,000, if not less. Nutrition, Mediterranean diet, or the DASH diet. Now, the 5th one is another S. I can't remember what that stands for. Give me a second. I got it. Sorry, it took me a while, but while I was trying to figure it out, I almost fell asleep. But that's the reason, is because sleep. This is the one that I struggle with, and this is why sometimes my weight struggles, and I notice that my weight is a lot better once I've had better sleep. But ideally, you want it to be at least 7 hours of sleep. If you can do that, with that sleep can be, sleep / stress management. There's a lot of things that we hold on to, and when we hold on to it, unfortunately, it manifests as heart disease, high blood pressure, and other different ailments. So talking to a therapist, talking to someone to help you to sleep better, psychiatrist, psychologist, anything that you need to help with your stress and to help with your sleep. And the 5th and final one is with being a physician, I got to throw myself in, is F for follow-up. You need to follow up with your medical provider at least once a year, if not multiple times a year, until we can figure out what's causing your blood pressure to be so elevated. But more importantly, a lot of people have high blood pressure due to something else. This is known as secondary hypertension. Most common causes are due to undertreated or under-recognized sleep apnea, but obesity is one. Issues with your thyroid, issues with many hormones, all of those play a huge factor into why your blood pressure is elevated. And if you don't know that, you're not going to get your blood pressure treated. What makes sleep apnea so frustrating is that if it's untreated, I find that a lot of these patients, a lot of my patients are on multiple blood pressure medications and it's still not being under control. So it's extremely important to follow up with them to get that treated, but also to look at other possibilities. Magnesium or potassium deficiency can play a huge factor. Anemia can play a huge factor. So we get all these labs, these routine labs, to make sure that our hormones, our electrolytes are balanced so that we get our blood pressure treated. We get we get treated how we deserve to be treated and not just put on medications. Now, I put this G. This G is me. And this G is a lot of individuals too. Genetics. Genetics also plays a huge factor into blood pressure not being well controlled, being that if your parents were on blood pressure medications, there may be a genetic component of it that may have you being on blood pressure, having high blood pressure itself. I remember when I was 20, 21, 22, between 190 to 200 pounds in really good shape. I think that time I had probably 15% body fat. So I was in really good shape, but my blood pressure was still elevated, and that was because of genetics. I finally didn't want to have a stroke in the future, so I started taking medications for it, and now I myself have weaned myself down to the lowest dose, and hopefully will be weaning myself off of it in the future with the assistance of my primary care provider. So our goal is to get all of these things to work for you. We want you to exercise. We want you to watch your weight loss, remembering that if you can lose for every 2.2 pounds or 1 kilogram, your top numbers, the systolic blood pressure will decrease by 1 millimeters of mercury. 22 pounds, 10 millimeters of mercury, it drops by. Salt nutrition, ideally you want it to be 2,000 grams or less of salt. Nutrition, DASH diet, Mediterranean diet. Sleep 7 hours. Stress, get that checked. Follow up with a medical provider. Follow up with a psychiatrist, a therapist, someone to talk to and figure out what is causing your stress and ways that you can manage it. And following up with your medical provider on a routinely basis, hopefully at least once a year, if not more, for more appointments and figuring out what else can be causing your blood pressure to be elevated, looking for secondary causes, and understanding that genetics plays a huge factor in your blood pressure, and that may lead you to being on blood pressure medications if you've done all of these other 5 things with exercise, weight loss, sleep, nutrition, salt control. My name is Dr. Iseng, and if you like this video, you're going to like this next one about palpitations.